Hello everyone, thank you for joining us today. My name is Nicole Keller and I am the Employee Benefits Supervisor. Today I have here with me Karen Rao, who is from Basic Pacific. They administer our cafeteria plan, and she'll be talking with us today about both the FSA, the Flexible Spending Account, and also the HSA, the Health Savings Account. Here's to you, Karen.
Thanks so much. Thank you very much for inviting me here. It's always a pleasure to come out and be able to present to you each year. So today we're going to start with the flexible benefit plan first. Your flexible benefit plan runs January 1st through December 31st annually. What exactly is a flexible benefit plan? It's a plan that allows you to pay no taxes on your medical, dental, and vision insurance premiums and save money on out-of-pocket medical expenses through the Health FSA, as well as out-of-pocket daycare expenses under the daycare plan. It allows you to actually stretch your dollars, as you can reduce the taxes by paying no federal, state, Social Security, or Medicare, or even SDI tax. Here's a list of sample expenses that are very common that families have that they can save money on. I'll review the whole full Health FSA first. There's a lot of expenses that are considered medically necessary under the IRS guidelines. They even include things like acupuncture, chiropractic, of course dental, orthodontia, and even other expenses like laser eye surgery. So those might be things you haven't thought of before, or maybe aren't even covered by your insurance, but they would be eligible under a Health FSA. Online through Basic Pacific, you can also go to FSA Store. This is a great third-party resource for you to not only look up over-the-counter items that may be eligible for reimbursement under the Health FSA, but they also have an extensive list of eligible items under the Health FSA for treatments you might not be aware of. The plan does allow for over-the-counter health items like Band-Aids and arm braces and things like that. It would further allow you to be reimbursed for drugs and medicines provided that you have a prescription from your provider. The debit card is a convenient way to pay for your over-the-counter drugs and medicines as long as you have a prescription to use at the pharmacy for your RXs. And you can elect for the amount that you pay for any kind of maintenance drugs that you currently have. Note that there is no reimbursement for certain items that are listed here. Things that are cosmetic, or your health club use, or massage therapy without medical necessity. The Health FSA allows you to pay no taxes on qualified medical expenses incurred by you, your spouse, your dependent children, anyone who qualifies as your federal tax dependent, and it even allows you to be reimbursed for your adult child through age 26, even if they don't live with you. You can elect up to the new maximum this year of $26.50, and your annual election will be deducted in equal installments throughout the plan year from your paychecks. You may be reimbursed for your whole annual election at any time. Los Rios actually pre-funds this account on the first day of the plan year. Do not elect more than you can actually spend in the plan year. The plan is referred to as a use it or lose it. So you do want to be conservative and only elect for those expenses that you know you and your family are going to incur. You'll receive a welcome packet along with your enrollment confirmation that will help you submit claims and have further information about how to maximize your account. Note that if you are participating in an HSA, meaning you're on a high deductible health plan and plan to make HSA contributions, that you may not enroll in the full Health FSA. However, you do have access to a limited use FSA that can be used for dental and vision expenses only. And the maximum is the same in that account, $26.50. You will be provided with 2 red Benny cards that you can use at point of service for easy availability of your funds. Even though you have a debit card, it is important that you save your supporting documentation. While regular co-payments under your health insurance plan, like $10 or $20 co-payments, will auto-approve at point of service, other expenses that you might incur would require documentation as backup. And we'll send you a reminder about 5 days after you swipe your card if your documentation is required. The debit card is used at retailers all across the United States and works really well for your over-the-counter supplies. There are thousands of supplies that are eligible that you can use your card directly at the retailer for. Let's talk a little about the dependent care account. Eligible expenses under the daycare account allow you to be reimbursed for qualified expenses for you and your spouse, if applicable, while you are working or looking for work. It allows you to be reimbursed for expenses incurred by children under the age of 13, as well as any adult dependent who may be living with you. It does cover pre-kindergarten tuition, meaning preschool, so under the age of kindergarten, but once your child reaches kindergarten age and is going to kindergarten, then it would only reimburse you for their before and after school expenses, as well as those you pay during school holiday or summertime, as long as you are working. Note that the daycare account is reportable on your taxes. So if you defer money into this account, be sure to have the tax ID, name, and address of your provider available when you file your taxes annually, because you will be asked for that information. Even day camps are okay for reimbursement. So during the holiday, if you send your kids on a week day camp excursion whereby they are going each day to a special program that has some kind of theme to it, like basketball camp, that's still eligible under the rules. Please be aware that there are some ineligible expenses under the daycare account. There are no overnight camps, and food, supplies, field trips, things like that that are broken out are not eligible under that account. So if you send your child to piano lessons in lieu of after-school care one day, don't count that expense. The piano teacher is not the care provider for them. Also be aware that you cannot pay any of your tax dependents if they care for your children under this program, or any child who is under age 19, even if they're not your tax dependent and they don't live with you. Your provider does not have to be licensed, so if a neighbor watches your children, they are eligible as long as they plan to claim that expense and you plan to report it. You may elect any amount up to $5,000. Don't elect more than you actually spend. So make your election based on your current monthly expense. This account too will be taken out in equal installments from each paycheck throughout the year. Unlike the health FSA, this account is not pre-funded, so you will only have access to your reimbursements as contributions are made through payroll. You can file claims for the FSA accounts online using the Basic Pacific mobile app, using your debit card for the Health and Limited Use FSA. You can send them in by email, fax, and even snail mail. The claim filing deadline annually is March 31st. Your plan also has a special provision called the grace period. With this grace period, it actually extends the eligibility period from December 31st until March 15th, giving you 2.5 months to spend out your account each year. It's easy to enroll. You'll roll online at basicpacific.com And if you're a current user of our system, you'll go to the same place where you go to check your personal information on your existing benefits. A login has been created for you, and instructions will be provided. For non-debit card claims, be sure that you keep all your documentation. You may be asked for that, and the pieces that are required for that claim would be date of service, provider name, the patient name, description of service, and the amount that you owe for the service. Your insurance carrier must also process your claim and pay that claim before Basic Pacific can reimburse you if that expense is covered by your carrier. For FSA, you may only change your election under very limited circumstances, such as adoption, birth, divorce, that type of thing. So if you have an event that you think qualifies, you'll go to your benefits team and request a change. But be aware, those changes are restricted. So you only want to elect for the expenses you know that you're going to incur. For daycare, the change rules are a little bit different. So if you have a change in provider during the year whereby your cost suddenly changes, you can go to your benefits team and request that your deduction is changed in order to correlate with that. Here's a simple screenshot of our home page online. And you can file claims directly online by clicking on the File a Claim link, and it'll take you step by step right through that process. It really does pay to participate in the FSA. Remember, you're going to save taxes on health insurance premiums, so any portion that you have to pay in order to have coverage through your employer, those will automatically be pre-tax. Then in addition to that, you can choose to put money aside under the Health FSA for your out-of-pocket medical expenses, or put money aside, and put money aside for your daycare expenses. So you can save a lot of money by diverting some of your wage and turning it into these benefits. You can also save money by participating in the HSA benefit, but note only federal taxes will be saved on that account. Most participants save between 25 and 45%. So that's like receiving a big discount at point of service. There's very few places that you can go and pay for service, and they'll give you a 25 to 40% discount on that service. Are there any questions? Okay, I'll move forward. Okay, we're going to move into part 2 of the presentation and move over to an explanation of the Health Savings Account, or the HSA. Basic Pacific is the third-party administrator for your health savings account. We're located in Roseville, and we have over 15,000 employers that we service nationwide. But note, we're not the bank for your HSA. The HSA custodial bank is Healthcare Bank. It's a division of Bell State and Trust located in Fargo, North Dakota, and is the largest privately owned bank in North Dakota, South Dakota, and Minnesota. They hold over $2+ billion in assets, and they are one of the largest HSA providers in the nation. What exactly is an HSA? It's a unique tax-favored savings investment account that can be used to pay for either current or future medical expenses. What makes this unique? There are no federal taxes on your contributions, no federal taxes while your money grows, and no taxes of any kind on withdrawals for qualified medical expenses. Note that in California, it is not currently tax exempt. From day one, any monies that go into that account are all owned by you 100%. So think of it as an IRA for medical care. Who may contribute to an HSA? If you have a high deductible health plan, you may contribute to an HSA unless you are also covered under another medical plan that is not an ADHP plan. You are covered under a full health flexible spending account that reimburses you for medical services already, or you are enrolled in Medicare, even Part A, or you are claimed as a dependent on another person's taxes. What expenses may be paid for under an HSA? Your HSA can be used to pay for the following types of expenses. Similar to the FSA that I discussed earlier, it'd be any out-of-pocket expenses not covered by your insurance, so your deductibles, co-payments, co-insurance portions, of course dental, orthodontia, vision, prescription drugs and medicines, but do get a prescription for those and keep those in your record. Amounts paid for any alternative health care, like acupuncture or chiropractic. Those two are eligible. And there's thousands of medical supplies that you can purchase and that would be eligible under the HSA. Be sure that you only claim expenses after you open your HSA. So any expenses you and your family have incurred before you open that HSA, those would not be eligible for reimbursement. It'd be from that day forward and into the future. Here's a quick example of some of the items that are eligible and other drugs and medicines that actually do need a prescription. This is a self-managed plan, so it's very important that you personally take responsibility for keeping receipts and records. Do not use your funds in your HSA for cosmetic treatment or health insurance premiums. And note that if you withdraw your money for non-medical expenses, you would be subject to a tax penalty of 20%. So if you have money in your HSA and you want to withdraw that and you save your expenses throughout the years, you can take a qualified distribution to yourself later on down the line. That would not be subject to any penalties because it would be a qualified distribution to yourself for qualified expenses. But if you decide you just want to go on vacation, if you've got a lot of money built up in there and you take that out, then you will be penalized. You can use the tax-free HSA funds to pay for qualified expenses incurred by you, your spouse, your dependent children, and your federal tax dependents. This plan does have restrictions on using the money for your domestic partner who is not your federal tax dependent. You also cannot use this money tax-free to be reimbursed for your adult child expenses. So they have to be dependents within your household. Those age 26 rules do not apply to this account. You'll be able to contribute through pre-tax salary deduction out of your check, and upon qualification, you can also potentially receive deposits for employer contributions. You also have the ability to transfer balances from another HSA. So if you're a holder of an HSA elsewhere and you join the Los Rios plan, you can move that money into that account, so a bigger amount is earning interest altogether. If for some reason you leave, this account is yours, so you would be able to transfer that money to another account of your choice as well. You can make the direct deposits from your personal bank account as well, electronically online. The maximums for 2018 for those enrolled in individual health coverage would be $34.50 or $287.50 per month. For you who are enrolled on family coverage, you'd be eligible to make contributions up to $6,900. That's $575 per month. Please note that any employer contributions that you receive count towards your total for the year. So employee and employer contributions act the same. The district would just be putting money in on your behalf. Also, if you are 55 years or older, the IRS allows you to contribute a full $1,000 more, regardless if you're on individual or family coverage. There's an interesting thing called the full contribution rule. This only applies the first year that you open your HSA, and it only applies when you open your HSA in a month other than January. This allows you to open your account later in the year if for some reason you've delayed, and still put in 100% of the 2018 maximum. There is one catch though. You must remain on the high deductible health plan and stay qualified all the way through the next tax year. So in this situation this year, if you come on in July, you open your HSA, contribute the full amount through December 31st, 2018. You need to remain on the qualifying ADHP plan all the way till December 31st, 2019. You can change your payroll deductions at any time. So just be sure to submit a request to the benefits team prior to the close of your payroll period, and they will make the change on the next open payroll. This is also an investment account. So it's not just a savings account, not just a medical account, it's also an investment account. It does allow those components where you can invest over $2,000, and you can decide how much you want to invest, how you want that money to sweep over, and how much at what time. You have a large variety of funds that you can invest in. It's all available online through the Basic Pacific portal 24/7. So you have lots of availability to manage your personal funds in the manner you see fit. Here's just a sample screenshot of contributions, distributions, and history under the HSA Online. Here's sample investments for the portal. You can check your funding performance online. Excuse me. How do I access my funds? You can pay at point of service with your debit card. Or access distributions online 24/7. If you request a check to be paid to your provider directly, we send out those checks on Wednesdays and Fridays, except for holidays. You can request those directly online, and then they'll automatically be forwarded to your provider of choice to pay a bill if you choose not to use your debit card at point of service. There is a small convenience fee of $2.50 per check should you wish to have us pay your provider directly. You have access to 100% of your account balance at any time. There is no minimum requirement. You may pay for expenses as they occurred for you and your family, or you can delay and be reimbursed in the future. Just hold on to all your receipts so that you have proof of qualifying expense. The easiest way is to pay your provider directly with the Benny card. You'll be provided with 2 cards in your name since you're the participant and account holder, but you can give the other card to an adult dependent in your household or your spouse, and they can use it at point of service to access funds should you desire. The card can be used as credit, or you can request a PIN by calling into the number on the back of the card and requesting a PIN and using it as a debit. Enrollment is also easy for the HSA. Upon qualification, your benefit team will provide you with an HSA enrollment form that has all the necessary disclosure information and important information about opening your personal HSA bank account. You do not have to re-enroll in this benefit annually. If you're already on the ADHP plan and you have an open HSA through Basic Pacific, there's nothing you need to do. That will remain active still. If you do need to fill out a form because you are newly opening up an HSA, be sure that you use the fillable form as PDF and fill that in, and then print it out and sign it, or write legibly. You'll want to triple check your information for accuracy because it does go through an identification process through the Patriot Act, just to be sure that when you open this bank account, that it's really you and your account and your personal information. Is it your money? Yes, from day one. As soon as it's deposited into account, it's your money. How often can you change your HSA payroll contributions? Whenever you desire. So just make a request. Can you use the tax-free funds if you are not enrolled anymore on your ADHP plans? Yes, you can. So being on the ADHP plan qualifies you to make contributions. Once that money is in there, then you can make a distribution that qualifies in the future, even if you move off onto an HMO plan or a PPO plan. Is it portable? Yes, it is. You can transfer it to another qualifying account, or you can make a distribution to yourself, but note, if it's not qualified, you will be subject to taxes and penalties. In summary, it's your money. There's no federal tax on contributions, growth, or withdrawal of these funds on qualifying expenses. Interest is paid from first dollar. Full family of interest options are included. You can change your contribution at any time. There's no charge for debit card transactions or direct deposit withdrawals or contributions online. You have access 24/7. And once enrolled, you don't have to enroll each year. So hop on board with the over 20 million people who are saving money through HSA. Any other questions? All right, thank you so much. Feel free to contact Basic Pacific if you have any questions or concerns about your account. If you have questions before making choices into the FSA or the HSA, feel free to give our customer service team a call. We're happy to help at any time. Thank you so much.